Planning to expand your family can be such an exciting time, and it's also important to check in with a physician if you're building a family a little later in life. Friend to the show, Alexa Lee, stopped by Akron Children's Hospital to learn more.
If you're considering getting pregnant in your 30s and 40s, first of all, congratulations. But we invite you into this conversation here at Akron Children's, where we are with Dr. Candace Snyder. And I think this is such a great conversation to have, especially right now. So what health problems should women consider and know about who are considering getting pregnant in their 30s and 40s?
Yeah, so right now a lot of patients are seeking pregnancy in their 30s and 40s, so it's a really important topic. And we know that as we age, we're not as healthy as we were when we were younger, so things like diabetes and high blood pressure and obesity are more common as we age, and those things can definitely impact a pregnancy. So having those kinds of things under control and optimized before pregnancy can make a big difference.
So how can we get healthier before we get pregnant?
Yeah, so that's a very good question. I think the most important thing is kind of focusing on your general health, making sure that you're kind of on target with all of your kind of routine health maintenance with your primary care physician. That includes getting vaccines, especially for things like measles, mumps, rubella. That's something that can definitely be dangerous in pregnancy. So staying up to date with your vaccinations, eating healthy, trying to exercise and maintain a normal BMI, which is difficult, but can really improve your pregnancy. And then also just getting used to kind of eating well and making sure that any diseases that you may have are well treated before the pregnancy. And also talking to your physician about medications you might be taking, because some medications can impact pregnancy. So kind of getting those things talked about before pregnancy is important.
So being proactive, that's very great advice. So what are the risks for babies as we age?
Yeah, so as we age, there's an increased risk for genetic abnormalities in babies, as well as birth defects. In addition, things like preeclampsia is more common and growth abnormalities, which could even cause an earlier delivery.
Okay. And what tests do we have for babies to check and make sure everything's going right?
Yeah, so fortunately, we have a lot of different things that we can do to try to decrease mom's risk during the pregnancy. One is we offer a variety of genetic tests during pregnancy to kind of screen for genetic abnormalities. And the most common one that we use is a blood test in mom. It's actually a really great test. So it's a great advancement that we've made. And fortunately, it has no risk to the pregnancy because it's just a blood test. So that's probably the most common thing that we offer. In addition, we do detailed ultrasounds to look at babies to make sure that all the structures appear normal. And then we can monitor babies with ultrasounds to follow their growth and their well-being to make sure that they're doing well inside of the womb.
Okay, well, for me, I think the big question is, why is it harder, right? Like, why do we have these risks as we age? Why is it harder for us to get pregnant and make sure everything's going well?
Yeah, so we're born with all of our eggs. We have all the eggs that we'll ever have at birth. And so as we age, the quality and number of those eggs decrease. And so it becomes harder and harder to become pregnant with each year. And so the things that we can do to try to help women get pregnant include they can see a fertility specialist, and they can be offered things like hormone therapies and in vitro fertilization to try to improve their chances of pregnancy.
Is there anything else that you should offer for folks at home who are listening, they're in this situation, that they can do to help that pregnancy and help it be a smooth one?
Absolutely. So we as maternal-fetal medicine specialists, we see patients even preconceptually. So we offer consultation for women who are planning a pregnancy, who have questions, who may have some medical conditions that they like to talk about before pregnancy. And we can offer advice on how best to decrease their risk during pregnancy. And then we can see them during the pregnancy and make recommendations on how best to optimize the pregnancy.
Well, Doctor, thank you so much for all that you do. And as always, there's more information for you right at akronchildrens.org. Thank you again so much.